the web. And I think we're all set.
Awesome. Thank you, Shelley. All right. So do we have anyone on the line that just called in so I can capture you in our attendance? All right. And if anyone is, I know a lot of you sit together like duplicates on a meeting. So I only have one name that pops up. So if there's multiple people on one account, put the name so that I can get you guys when I do the attendance. Yep, perfect. Thank you. All right, let me switch screens. All right. Okay. So first, this is kind of silly, but I went to the USS Midway with my family over the weekend, and I saw this, and it said NTDS consoles, and obviously it wasn't talking about NTDS in our world, but I saw it and instantly thought of everyone. I wanted to share it and say that data is always on my mind. I'm always thinking about you guys, so I thought that was funny. So next is the minutes from the meeting. I do not have news on the RFP. I anticipate it being announced this week. I was hoping to have news to share with you today, but not quite. But we're really close. I can't say much else other than that, but I do anticipate an announcement very soon. All right, so just remember that our next data submission due date is April 1st, and then make sure and do any corrections within 15 days of receiving them. I'm a little behind, so usually I have those to you guys sooner, but we've obviously been very busy, so I'm trying to get those out to you guys, but I'm still finishing up some of the third quarter validations. We've been really great at submitting data on time, so thank you to you guys for being on top of that. Our numbers are higher than ever before since we've been collecting that, so doing a great job. So first thing is, I know we went over the entity changes in our October meeting, but these are the changes that are going to be reflected in our 2025 ASTR data dictionary. So I have an updated data dictionary I will send out with the meeting minutes so that you guys can have that. There's a full and a reduced data dictionary. So this is just a reminder on the NTDB is there are one change and 2 new ED discharge dispositions. So it was changed to add hybrid OR to operating room, and then IR was added, and then hospice as well. So those have been updated on the pick list, and those are for 2025 records. And then also added what were pre-existing conditions, which those of you who submit a reduced data set, you don't collect this, but for the full autism spectrum disorder, bronchopulmonary dysplasia or chronic lung disease, and then ventilator dependence. So those are all added. Any questions on those? Okay. Several people have asked because the new registry, some of the names are different from what we've traditionally captured in Trauma 1. And even though they're mapped to the same variable and they mean the same thing, the names are a little different. So I am going to do some type of overhaul to include that in the data dictionary. There is the matrix that ESO has, which shows all of those. So I can send that out so you have it ready right now, because I don't have the data dictionary ready with that update yet. It'll take me some time, but I will do that, but it's not currently in there. But I'll send out the matrix so that it kind of shows the name of the traditional ASTR data dictionary field and then what it is in the new registry. So I think that will be helpful. There was just a little update on the autopsy number data hierarchy. Someone had pointed out that it didn't include an autopsy report and that it listed a bunch of other things, which didn't really make sense. So I just updated that. Also, this is only for the new registry, and going forward is the state patient record number. So you guys have probably noticed that the state patient ID, which was an auto-populated field from Trauma One, doesn't auto-populate in the new registry, but that's because it has the registry number, which is essentially the same thing. So we don't need the state patient unique or the state unique patient ID, because that was the one that included kind of the little marker of what hospital the patient came from. And so the registry number will include that. So we don't need to duplicate that. So so I'm working with ESO to have that removed. So right now you can just put NA. Some of you are copying and pasting the registry number into the state unique patient or the state patient record number field. That's fine as well, but it will be going away, so you don't need to worry about that. Any questions on those so far? Okay. I also added, there were some missing age requirements for specific pre-existing conditions. So that paragraph under pre-existing conditions has been updated. The age cutoff is 15. So some of them say that they have to be NA if the patient is over 15, and some of them say that they have to be NA if they're under 15. So I've added, it's just the same as what NTDB says, but I've added it to our data dictionary because we mirror their requirements as well. And also I wanted to kind of do a reminder for those of you who are on the new registry. There's a lot of extra data elements, right? And you don't need to capture anything other than what we're requiring, and if you participate in NTDB, what they're requiring. That being said, I know that you guys know that there are kind of their ESO registry, like foundational fields that have to be collected for just how the registry functions. So if they're locked, you can't turn them off. Some of them, like the order date times, are going to be unlocked in 2025 so that we can turn those off. But especially for those of you with a reduced data set, if you're seeing something extra that you don't normally capture, you don't have to capture that. And if you need help turning off fields that you don't think are part of the original requirements, let me know and I can help you with that. So again, I will send out the updated 2025 ASTR data dictionary, the full and the reduced. So any questions on all of those? All right. Okay, so we had some questions about the drug and alcohol fields. So I hear a hand raised. Shanna. Yep, go ahead, Shanna.
Can you hear me?
Barely. You're pretty quiet. Let me turn up my
Can you hear me a little better now?
Yes.
Okay. I was just wondering if anybody has made a cheat sheet for the pre-existing conditions, the peds versus the adults. Like, it's hard. I'm not used to that, and so it's hard for me to remember like which ones need to be NA for the peds versus the no. And I was just curious if somebody had made a cheat sheet. I wouldn't make one, but if nobody has, I'm gonna make myself one so I don't have to like keep validating and then going back in and changing and all that.
So I think that the way that it should be is on the back end, it'll flag. There should be flags built in. So if your patient is 16 and it's only something that should be captured on patients under 15, it'll say, you'll get a validation error that says, hey, you don't need to, this should not be NA or whatever for depending on that pre-existing condition. Does that make sense?
Right. I was just curious if anybody had made a cheat sheet.
Yes.
Ahead of time, you know what I mean? So while I'm in there doing it, I'm like, okay, this is a pediatric. This, and this needs to be NA instead of no. That's what I'm asking.
Yeah. I don't have that. Danelle, I would bet you are the most likely to have that because you're more aware of ped stuff. Do you happen to have a cheat sheet that you guys have made for that? Sorry to call you out.
Well, I made a sticky note on the side of my computer. I can take I did it for, yeah. Do you want me to send that to you?
Yeah, if you want to send that to me, type it up and then send it up. That'd be great.
I put in a request for ESO to add the ages to the description so that it would be easier just to do that. And then I also asked them if they could auto-populate that based on age. It seems like we're going backwards.
Yeah. Did you already put in a ticket for the auto? Because I think what you're saying is if your teen is less than 50, and it's not a limit, it would auto-populate if that age matches that. Is that what you're saying?
Yeah, I put in a request for that, but
Okay,
I mean,
right. That's good.
I don't
Hopefully
even know
it's
where to
good.
find it.
What was that?
Like, I don't know, like they said, if people put in enhancement requests to go and like it, and then it will boost it up, but I don't even know where to locate where people put in enhancement requests.
I will ask. I'm not sure either, honestly. So I'll ask and follow up. But let me add that to my list of questions. Okay. All right, I'll ask about that and follow up. But yeah, if you want to send me the sticky note you have, I can type that up and send that out to everyone. And then hopefully we will get to the point where they're auto-filled based on the patient's age, so you don't need to remember that or have that handy. Okay, awesome. Any other questions? Okay, all right, we're gonna go ahead and move to the data dictionary. Okay, so I'm just gonna run through these. I just had some people that had questions about the different null values that should be used and things like that. So the alcohol use indicator, use of alcohol by the patient, blood alcohol concentration test was performed on the patient within 24 hours after the first hospital encounter. Let's see what would be applicable. So it's any facility. So if it's at a referring facility, that's okay. This one is important too. So per NTDS, trace levels is defined as any alcohol level below the legal limit of the testing state, but not zero. So for our instructions, if it's less than 10 milligrams or a result too low to specify a value, then put no confirmed by test. Below or beyond legal limit in Arizona is beyond 0.08. And also for any patients under 21, any conclusive level would be beyond a legal limit. So if you get a flag saying you put that it was beyond the legal limit, that's because they're under 21. So that is okay. Not documented is if they're not tested. Not applicable should not be used. So make sure you're using yes, no, or not documented. All right, this is where then blood alcohol content. I know there were some questions on the new registry with some weird flags with how you're recording it. So I'm still working with them to look into that to make sure we're all recording it the same way and that we're not getting any weird flags. All right, and then drug use indicator, same as alcohol within 24 hours. And that's the first recorded drug screen result. We do match NTDB except for we added in fentanyl. Well, this is the results, yes, but the pick list options, no, not suspected, no confirmed by test, suspected use, not tested. So this, if they kind of said, if the patient said something and if there's any documentation that they suspect that there's drug use but not tested, then you would use that. Legal prescription drug use, if they have documentation of a prescription drug, then you would capture that. That would be like opioids and things like that they may have a prescription for. If it's illegal or confirmed illegal use or illegal prescription. So if it is a prescription drug, but they don't have documentation of that prescription. And then confirmed legal and illegal. So if they're using an illegal drug, but they also have a prescription for a legal drug and they're both in their system. And then this is just the pick list. This is a multiple pick list. So you can pick any of them that are in their system. Like I said, we added fentanyl. I know not all hospitals are testing for that, but if you are, make sure and record that. And that is pretty much it. Any questions? I know that was a brief overview, but for those of you that are newer, those are what those. Any questions? Okay. Let's go back to the other screen. All right. Okay, so interfacility transfers. With the new registry, there isn't the state versus NTDB like there is in Trauma 1 for interfacility transfers. So just so everyone's on the same page, I'm going to go over the definitions and then say what we're doing to capture those in the new registry. So for the ASDR in our inclusion criteria, it says transferred from one healthcare institution to another healthcare institution by an emergency medical services provider or ambulance service. And then NTDB was the patient transferred to your facility from another acute care facility. Patients who require physical transfer from a freestanding or include patients who require physical transfer from a freestanding emergency department ED to an affiliate trauma center, and exclude patients transferred from a private doctor's office or standalone ambulatory surgery center. So the big difference that between the state and NTDB is we at the state don't count transfers that are POV. So if a patient decides to go from one hospital to another, but they don't want to ride in an ambulance, then that doesn't count. We have to have that transferred by emergency medical service provider part for the state. NTDB doesn't have that clarification, so that's kind of what's always been the difference. So for the registry, since there's only that one spot, you can still include, you can go by the NTDB definition, and then I can build a population and look at how the patient was transferred to see if they went POV versus EMS. So you don't need to do anything special. I can take care of that on the state's end to look at how those patients were transferred. So does that make sense? Does anyone have any questions on that? Okay. Awesome. Okay, so registry transition. Appreciate all of your patience. I know we've had so many meetings, so many questions, and I know there's a lot of pending tickets open. So I'll go through this and then we can kind of talk about that. So the transition timeline, we've gone live. It's past January 1st, so you guys are putting real records into the system. So the next real big bit is the legacy data migration. So that won't be started until July. And the reason why there's a big gap is because you guys don't finish up data with fourth quarter until April. And then there's that time to do corrections and to finalize it. So we can't start migrating data until the data is completely finalized for 2024. So that's why we're beginning at that point. So any questions on the legacy data? And you will still have access to your Trauma 1 data. Some people have been concerned they won't have access. So at least through the end of the year, you'll have access, and until it's migrated over, you'll have access to run reports on that. So facility administrator access. So a big one is let me know if you're going to leave, especially for the level 4 facilities where I'm the admin. Let me know if you're going to leave so I can set up access for whoever's taking your spot. Because if I don't know who, or even if you don't know who's taking your spot, just put me in contact with someone at your facility so that I can get them login information and make sure that those permissions are fixed, and I can take away the permissions of the person that's leaving. Super important, just so we have everyone at the hospital having access to that system. So just let me know if you leave. Hopefully no one ever leaves, it'd be great. But and also for the higher levels, if you want to have someone added in, hopefully at this point you've kind of learned you can add in someone on your own and you can change their permissions. So if someone leaves at the higher levels, you can move that over to the new person. But if you need any help or have any questions on that, let me know. And we don't at the state have any specific standard for these are the privileges or permissions, I should say, for people at a hospital for what access they have. They're your own system. So you can say if you want your registrars to have access to everything, to running reports, changing stuff, that's totally up to you. But just know that you can change permissions and decide who has access to what. So the next thing is, I heard a hand.
I'm sorry. There was a question in the chat. I'm sorry.
Thank
you already addressed it.
No, you're good.
From Keith.
Keith, I don't have a good answer for that. That's how it's always been. We don't always align with NTDS. I can look into it more. I know that we run a lot of reports on alcohol use, so I can talk to our statistician and see if there was a reason for that when they started ASTR, and I'll follow up with that. Let me add that to my questions. Actually, we'll take pictures of the chat, so we'll be fine with that. So, okay. Any other questions? Okay. So for linkage capabilities, so this is for those of you who have EPIC and Cerner. So the state contract with ESO has the ability for the EHR linkage capabilities. So those of you who have your medical or a hospital medical record system as EPIC or Cerner, you can reach out to ESO and they can work with you and your IT department to have that EHR linkage. So right now, all they have is the demographics linked, but it will help to auto-populate some of the demographic fields. So that is good. I don't really facilitate it on my end because I don't set it up or anything, but ESO has said if you reach out, they can work with your facility to get that set up. So, and I know not everyone uses EPIC or Cerner. I've been told that they are working on some of the other smaller EHR systems. So, but right now they have EPIC and Cerner ready. So any questions on that? Okay. So I know a lot of you have talked about the financial data linkage because there is not the linkage that we've had in Trauma 1 where you upload the fields or upload the form and it is taking manual entry, which is not fun. I totally recognize that. So I've said this before, but you guys can go in and submit feedback. And I will show you that for those of you who don't know how. Let me change my screen. So essentially they've said, if you get a lot of people asking for the same thing, the chances of it happening and enhancements being made are greater. So I would just encourage everyone to go in and say, we would love the ability to link financial data. Okay, so this is if you go into the registry section, and that's the same thing for anything. If everyone agrees, hey, it would be really great if this enhancement was made, that's not part of the regular like things that you can customize. If everyone is saying it, then it's more likely to be done. Okay. So timeline, I've asked for a timeline from Jody and he hasn't given me a specific timeline. But he says that they do major updates every 6 weeks. So I would hopefully anticipate by 6 weeks, they'll have that on the list of updates. I can follow up with him on that, but he didn't have a set timeline for me on those big updates like that. Yeah, I'm not sure. I think for the EMS triage list, most of those are pretty similar. You can go ahead and keep using the list that it's not, I don't think it's going to be earth shattering for the EMS triage list, and then we'll get it fixed when we can get it fixed. So that you can close those records at least with the EMS triage criteria list. Okay, let's go back here. Okay, so this is just a practice environment, but if you click on this question mark, go to feedback, it says suggest enhancements, and you just submit feedback. So text whatever you're suggesting here, submit feedback, and then I'm going to follow up on where you can kind of upvote the ones that you see that you like. So I'll get back to you on that. Let's see, go back here. Yes, yep, looking at the alcohol level errors. Yep, that is on the list. And since we kind of talked about different, I know you guys have also sent in tickets, right? Everyone has sent in lots of tickets. It's a new system. There's bugs. That's normal. I know that it's frustrating and we're trying to get them all worked out. So ESO sends me a list every Friday morning of all of the open tickets as well as all of the closed tickets for the last 30 days. So even though I can't fix the tickets and answer all of your questions, I am aware of it. So if I see that right now, most of them are only a week old, and I know that's can be frustrating, but if I can see that and see that they're over a week old or it's getting really long, I, at least at the state level, can see that and kind of advocate for a quicker resolution time on those tickets. So I'm glad that I can see which tickets are being put in and how long you guys are waiting. All right. Let's see. I'm going to share my other screen. All right. So the next steps are we're going to be running kind of test records for submissions. So how this registry will work is you guys will, kind of similar to submitting to NTDB, is you'll have a file and then you'll upload it into the state repository. So I'll be working with ESO to do test batches for those submissions to make sure that's working as well. So that's also another kind of part of the puzzle we'll be working on next. And then I didn't share. There we go. Okay, and then, yeah. Danelle's question, where is everyone entering their activations? You can add it in pre-hospital arrival, ED, inpatient, etc. Yeah, I think ED makes the most sense flow-wise, would be my thought. I'm not sure, frankly, why they have it in so many spots, but I think you put in a ticket for that, Danelle, so we can see what they say as to why there's so many different options and where to put that in. Okay, all right. Okay, so next is pick lists. So pick lists are going to be different from Trauma 1 in the sense that I will not send out a pick list update for everyone and it will automatically be updated. Your guys' systems are much more individual per facility, which means I can't go into all of your systems and update your pick list. So you guys, those of you who are reduced data set that I'm your admin, I will make your pick list changes for you. But those of you who are a full data set, you will need to make your pick list changes. So that being said, historically, we've all had the exact same pick list, right? But we don't necessarily need to have all of the same pick list options, just as long as they're the same when we are picking them. So you will need like the the facility ID or the agency ID, which I have. So for instance, this is an update that we recently made in Trauma 1, was El Mirage Emergency Room and Medical Center. I think this is down in Tucson. I could be wrong. But if you're up at Flagstaff and you're never ever going to get a patient from El Mirage Medical or Emergency Room and Medical Center, you don't need to add it to your pick list. You can, that is one good thing, is you can shorten your pick list to only have ones that are applicable to you, so you don't have to keep scrolling. So if you come across an EMS agency or a new facility that's not in your pick list, let me know so I can check and get the facility ID for you, and then you can add it to your system. So whenever anyone lets me know of a new EMS agency or facility, I'll send out that information to everyone. And then if it's something that the EMS agency or facility that will be in your area, then you can add it to your pick list. Does that make sense? Hopefully that makes sense. Awesome, great. So, all right. And I do have a list of, there are a couple of EMS agencies or facilities that are missing on the list for some reason. So I have a full list of all of those with their numbers that I can send out. I think I've sent it out to some of you. I don't know if I've sent it out to everyone, so I'll include that in the minutes as well, so that you'll have that. Same thing with pick list options that if you're at a hospital that, as long as it's not a state designated pick list, right? But you can shorten your pick list if it's not locked for things that match your facility. But okay, so there are 2 changes that need to be made. Whoop. So the first one is for EMS pre-hospital patient arrived from. So I'm going to go ahead and show you guys how to do this, but there's a home option. It's 1.1 that should be turned off. And then the list isn't updated to match the ASDR list for whatever reason. So, and ESO is still working on, if you remember, the changing everyone's for some of those extra pick list options. They haven't done that yet. Jody said they hope to have it done next week. But I'm going to show you how to change that pick list for those of you that may not be as familiar with that. Let's see. Okay, so you are on your, let me make sure you see my screen. Yep. So if you go down here to this little wrench, and then actions, view. So we're going to be changing a pick list. So you're going to go down here to lists. Okay, and then we are looking for the pre-hospital patient arrived from list. Okay, so if you go over here to actions, see this is the one we're looking for, and view.
I'm not seeing your screen. I don't know if anybody else is.
Is anyone seeing my screen? I see it on my side, so I'm not sure. Is everyone not seeing?
I can see it.
Oh, so people are seeing it. So who was it that said they couldn't see it? Okay, maybe
It was Jody. I could see it a minute ago, but I just see your computer picture.
That's weird. Let me try to stop sharing and then share again. Okay. Can you see
I
it
can
now?
see it now. Yes.
Sweet. Okay. Good. All right. So, so if you scroll down, I've already turned it off in the test environment, but it's the 1.1 home. So we're going to go ahead and turn that off. And the reason for that is this is seeing where the patient's coming from. And we have this home non-seen down here that's turned on. And then there's also the scene option. So the home option doesn't really make sense, and we don't need that. So turn that off, and I'll include all of this in the minutes and the notes as well, so you're not having to frantically take notes. But then also, and I'll include a snapshot, but there's a lot of extra options that need to be turned off that don't match the ASTR pick list. So I will send like a snapshot of the data dictionary so you have that on hand, and you'll just go and turn off the ones that don't match the ASTR data dictionary. So, and then I'm going to show, it'll take a minute, the first change you make, because it's making essentially a copy of your template so that you have one that you're making changes in, but it saves the old one in case you need that. So we'll wait a second. And then once this finishes, nope, it won't let me click on it while it's loading. Okay, any questions while we wait for that to load? All right. Let's try it again. Okay, well, I'm not going to really make the change, but if, say we make the change, after you do that, you have to go up here and push publish. If you don't push publish, the changes aren't going to be made. So that's very important to publish changes. Shanna, go ahead.
So I'm trying to do it real time with you as well.
Mm-hmm.
And I keep turning it off, and then it loads. And then when it refreshes to the new page, it's back on. And it's done that 2 times now. So is it just like the system error for a second, and eventually that will work?
So you turned it off and then it did the gray loading screen. And then when you re-turned on, it still was showing as on. Is that what you're saying?
Yes.
Okay. So,
It won't let me turn it off. When
okay.
it refreshes the page, it keeps going back to on. It's done that a few times now.
Okay. It should let you turn it off. It's not a locked option. So I don't want to say keep trying, but the system didn't let me do it either. So give it a minute and then maybe try it again. When you click
Okay.
actions, what does it show up here on actions? Does it say let you publish?
well, I just tried it again, so it's loading, so I can
Oh, okay.
see. But I was like, if I hit that publish, oh, that time it worked.
Okay.
It stayed off this time. Okay,
Okay,
and then hit publish. Okay.
But also
Thanks.
there's other ones that need to be turned off on the, if you go to the, here, I'll show it real quick just so everyone knows what I'm talking about. We have plenty of time. Okay, give me a second. Let me go to the right page. Okay, so these are the ones that should be turned on. So injury scene, referring hospital, clinic, urgent care, EMS rendezvous point, and then home, but home was not the injury scene, and then other location, not injury scene. So I'll keep this on and you can just screenshot it on your computer and then have that, or look it up in the data dictionary, but that's what I was talking about. Okay, let me go back. And then I think there was a question. Shelly, I still haven't got my multiple monitors set up. I really need to.
I was wondering if you had a second screen.
No, I need to. Okay, how to update the facilities pick list? Yep, we can do that. Okay, so the facilities pick list is different from this pick list option. So that's going to be in your admin section. So can you still see my screen? Yep, okay. So this one I'm not as familiar with, so bear with me. But so it's in the admin screen, you're not in your registry screen. And then I believe, let's see. Yep, okay. So if you go to general and then locations, there's all these options you don't really need to worry about. But the ones you need to worry about are EMS providers, because those are the ones you'll be editing most likely, and then hospitals. So if you click on hospitals, you don't really need to add multiple records. That's where ESO's given us the bulk of all the ones we need, but you can fill out a big Excel sheet if you needed to do an overhaul and add a bunch of them. But for now, just add single record. You'll put in the hospital name, the facility ID, med 17-9, whatever. You don't need to worry about the phone number, fax, email, unless for whatever reason you want to capture all this, then by all means you can. And then you'll push next. And then you do need to put in the address. And then you'll push next. I'm not putting in the real info, but you'll just go through the steps and you'll put in, it's not showing me the right screens, but yes, this is where you'll go and add it all in. And if there's any of the like facility IDs or anything that you need from me, let me know. I'll send out the spreadsheet of all of the info I have for all of them so far. Are we good on that? Any questions? Facility ID, I'll send you out. I have a spreadsheet of all of the hospitals with their facility IDs in the state that I will send. Okay, Phoenix Children's Arrowhead. I'll make sure that one is on the list when I send it out. Okay, any questions on that? Very quick overview of that. And then also, this is where if You don't have to, but if you only ever get transfers from 4 different hospitals, you can go on and turn off the ones you don't need, right? You don't have to, but makes your pick list shorter, maybe easier for you. It's an option. So I have to update the names. Yuma Regional. Yes. So you can go in there and edit, and you can just edit the names. And just like with Trauma One, if you're editing a pick list option, I would put the new on Vita and then also Yuma Regional. So you can kind of remember if there's old records or you're still working on an old patient and it's still under Yuma, keep it like that. Okay. Awesome. Any other questions on that? Okay, let's go to the next one. Sure. So there was another pick list change that only those of you who submit a full data set will need to make. So if you go back to the wrench, so it's for the activations, because the state only requires the complete trauma team arrival date and time. So that definition is kind of up to your facility. If you're at a level 1 and you have 8 different members of the team who have to show up for your complete trauma team, then that would be the time of when they all arrived, versus if you're at a level 4 and it's just the ED doc, it'll be the time of when the ED doc arrived. But so that the system doesn't have a field just for the complete trauma team arrival. So we'll go to lists. All right, team member. We're gonna, and we went over this at one of the DQA, the sessions with Jody. So if you're saying I already did this, that's fine. But just for those of you who haven't already done it. Okay, so it's under team member type. So if you go ahead and view that. So these are all the ones that are already there. So if you see down here, we have added this complete trauma team. So if you click on 99 other and do add plus N code, it'll give you this option to add in another field or another pick list option, which will be 991 complete trauma team. So when you're filling in the activation stuff and it asks, you can go to the trauma team type and put complete trauma team, and then that'll be your complete trauma team arrival date and time. Kind of a workaround for now, but that will work for the time being. Okay. All right. Any questions on that? And for updating pick lists, this is how most of the pick lists are that are unlocked. If you need to add extra pick list options, you can do that so that you can capture whatever your hospital needs. And then once again, I didn't make any changes, but don't forget to publish, because it won't work if you do not publish the changes. Shanna?
Hi, sorry, I'm just trying to do this all while you're showing us because I'll forget. But when I'm under the lists and I search for team, sorry, of course my kid comes in here. I don't have anything. It says sorry, no results were found.
For team?
Yes.
Okay. So we'll need to go.
I tried the. Oh,
Go ahead.
sorry. Go ahead. I was just saying I tried the field name and the list name, and it's not there.
So when you are in your registry, do you have the active, what do you see when you go in to look at the activation page or option? I'm wondering.
I don't even know.
Okay, I'll set up a time with you to look to see if the fields aren't turned on, then the pick list is not going to show up to edit. So if for whatever reason the fields are not turned on, then can I start over? Yes. But yeah, let's check to see if you want to go in and look at I'll show you where to check actually real quick. So if you just click on fields and then type in trauma team, check to see if trauma team type is turned on, because if it's not turned on, then that could be the issue. But okay, I will start over real quick. So go to lists, and then if you type in team member type is what we're looking for. And then actions, view. So scroll all the way down So you get to this 99 other, and then add, and then do just one. I already have it, so I'm not going to really do it, but do 99 one. And then for the description, you're going to write complete trauma team. And then it should.
So Carissa, when I searched the trauma team, what did you call it? Trauma team involvement, that field is off. So do I need to turn that on?
It should be trauma team type.
So the only one that pops up when I search trauma team is trauma team involvement
For fields. Okay.
for fields.
That's weird. I'm not sure. Do you mind if we set up a time and I can look at your screen and go over it and we can see if we can figure it out?
Sure, that'd be great.
Okay, awesome. We'll do that. Okay, awesome. Danelle, did you have any questions on editing the pick list for that? Danelle, do you also not have trauma team type popping up? In fields. Okay. Danelle, are you on the Phoenix Children's or the Arrowhead? Well, I guess they're all full data sets, so that shouldn't be.
I'm on Avondale.
Okay, but they're full data sets.
Yeah.
Okay. All right. So we need to figure out why you guys aren't seeing trauma team type. Okay, I'm gonna go into the registry and you guys let me know if you're if I have something you're not seeing, okay, on this test record. Okay. So activations, under responses, go to activations. And then let's go to, okay, so it's not on this one, it's on this.
So Carissa, really quick, I had emailed them about this. I'm having an activation error code, and the way that they told me to fix it when they sent me the screenshot, that's not what mine looks like. So I had to send them a screenshot of mine. I don't have all those options that you just had right there. I just have like, was the team activated? Yes or no. That's
Okay.
it in this, like on this screen right here as well.
Okay, let's see. So we're missing some fields. Did I go in?
I think you have to go turn them on.
Yes. I think I went into, I need to edit, not view. Okay. Okay, so you guys aren't seeing this when you go to edit an activation. You don't have any of this.
No, if you scroll up, the only option I have is, was the team activated? Yes or no.
Okay, so if you click on yes, does it then give you more options to fill in?
No.
No. Okay. No. Okay.
You have to go and update your lists.
Yeah.
Or fields and turn them on.
Okay. So yeah, you're missing some of them. Tracy, you're also, do you only see the yes or no for the activation? Do we need to go in and turn on?
No, when we went in, well, you were putting to add onto it in the past thing, we couldn't, we were having the same issue. We were trying to find the team, trauma team, and we weren't getting the full set like you were saying.
Okay, so it sounds like we need to turn on some of the fields that are missing. So I'll show you how to turn on field. We just need to narrow down the fields that we need. So if you go over to your template and then go to fields, and first make sure your organization is, you're on the right. You have AZ, Arizona, and then NTDB if you're also NTDB.
Yes, we have all those.
And then fields, team. Okay, so team member type, are you seeing that when you're searching the fields?
Oops. Yes.
Okay, it's locked, so it should be on. Is it on?
So my team member type is off. The
Okay.
only one that's locked when I search that field for team is team activated, and that one is on and locked, but the team member type is turned off.
Okay, that's weird because you're a full data set, so it should be locked. But okay, go ahead and turn that on. Anyone who's not seeing that, that should be turned on.
Okay, so team member type I'm turning on.
Sorry, caveat, unless you're a reduced data set, then you don't need to do that.
Okay.
And then let's see. Also, then the team member activation date and time should be on as well.
Oh, shoot. Okay.
Yep.
Okay. And then the team member arrived date and time.
Yep.
Okay. Team member elapsed time from patient.
Yes.
So Tracy, you guys are having, these are on for you guys, but you're not seeing them when you are at the activation page.
We're seeing them on the activation, but when we want to add that full team to the list, it's not giving us that option like the I think it was Danielle who said it.
Okay. Whose account are you on? I'm wondering if you guys don't, whoever's account doesn't have permissions to update pick lists, possibly?
I have the permissions and I'm on.
Okay. All right. I'm not sure then why it's not popping up. Shanna, were you able to turn on those fields that were not on?
Yeah, I was going to say, can you run through that list one more time? So
Yes.
team member activation date, team member activation time,
Yep.
team member responded date and time.
No.
Oh,
No,
I don't need those ones.
No, just team member arrived date and time.
Okay. Yeah, those are on.
Okay.
Those are locked for me now.
Okay. Sorry, who was?
So I just went and turned on fields.
Mhm.
Then I had to publish, and now I have access to that list.
Okay.
You have
turned
to
on
publish it first after you turn on the fields.
Okay.
Publish, and then you can update.
Okay, so Tracy.
I think we're good. No, we just figured it out.
Okay, great. And then Shanna, once we turn yours on, we can publish it, and then you should have access to that list.
Do I need the team member elapsed time from patient
Yes,
Did
that
you
one should be on.
and the elapsed time from activation
Yes. Mhm.
and team member timeliness?
Nope. The last one
And
is team member service.
team member oh, turn that one on too?
Yeah.
Okay. Okay, let me publish that. Okay, maybe that'll fix my errors. Okay.
That'll hopefully help. Tim, you're seeing the same thing, right? You're a reduced data set though, so you don't need to make this pick list update, but I'll go in and make sure that the reduced data set people you should still have just the basic trauma activation, yes or no, with the time of activation. Jody?
So should we have, if we're the full data set, we should have 321 fields like you do?
Yes.
Okay, so I'm right there with Shanna. I have the same thing. So I wonder if they put all the level 4s on reduced, even if we're full.
So
Is that in the data dictionary what we need to update?
So I have the data dictionary, the names are a little different for some of them, but I have the matrix that lists out all of the required data elements and then the name of those in the registry for ESO. So I'll send that out so you can compare and make sure you have the right ones turned on. Also go up to your organization submission and make sure it says Arizona full.
It does. So
it does.
I did
Okay.
check that. Yeah. And I'm getting like an error when I try to do the elapsed time. It's saying something about a validate, and so I can't publish it. So it's just odd.
Okay. So you're trying to turn on a field, but it's saying that it's not allowing it to turn on right now.
Yeah, it was. It
Okay.
looks like it might be letting me now. It just takes 2 or 3 times to to get
Yeah.
there.
I also wonder if everyone's in their system right now trying to make changes, so that may be why it's a little slow, but hopefully, okay,
So
we
I
figured
only
out- go
I
ahead.
only have 256 fields.
Okay,
Like I see what she's saying now. You have 321. Yeah, I only have 256.
So doesn't it matter if you're submitting to TQIP and or NTDB, and if you're not, it would be
Oh.
less, right?
yes, I was just going to say that this also has NTDB turned on, so I
Okay,
can send
that
you.
could be it.
Yeah, I'll send you the list of just the Arizona full required with the name of what they should be in the registry to make sure that you have the right ones.
That would be helpful. Thank you.
Yes. Okay. Awesome. And then Tim, for the level 4s, I'll go in and look at your the activation screen to make sure you have all of the right things turned on.
Okay. Yeah, because I keep getting an error. I have and all I see is the sorry, I was just there. On the response on the activations, it says date member. I can put a time in, but then I still keep getting an error. I can do a team member arrival date and time.
Yeah.
Oh, yeah.
Okay.
Yeah.
So maybe there's some that aren't turned on that need to be turned on. So we'll get those lists and make sure everyone has the right ones turned on. Okay, so Tracy, we got yours figured out. Shanna, we're going to meet. Tim, I'm going to look at the level 4s. Anyone else? Anyone else? Who's, it says name not available, but who said mine is also off? Okay. Oh, I think it's Kingman. So 244 may be right if you're not submitting to NTDB. So for Kingman and those of you who are a level 4 or a level 3 not submitting to NTDB, that I don't know the exact number, but I'll send out that list of what you should be having. So to add the Lillian, to add the extra or the hospital, it was I can go over it again really quick. Okay. All right, so you're gonna leave this area and go back to the main dashboard. So this is to add any extra, if you're making any updates to EMS agencies or facilities, this is how you will do that. So you'll go to admin, general, locations, and I think I'll send out like a PDF with like a marked up screenshot of how to get here. So you guys have that. So if you scroll down, you can ignore most of these. EMS, air, and ground, these are the ones you would click on to add in EMS providers. Down here, you're going to see hospitals. So Lillian, you'll go and add a single record. And I'm going to send out a spreadsheet of all of the hospitals in the state with their med IDs so that you can have the facility IDs. So you'll type in the name here, and then I'm going to send out the spreadsheet and you'll put in the ID. And then anything that's not required, you don't need to put in. Then you'll do next, and there's other information it's asking for. And once you finish all 6 steps, you'll just push publish. Yeah, we don't. If there's some that, like the state submission ID, a lot of hospitals don't. You can just use their med ID because they don't have like trauma centers. We have their state submission IDs, but you can put the med ID for that. It just needs to be unique, so you can't put one for all of them. Okay. Let's see, Lillian, any questions on that? Okay. And PICLIS will take some getting used to since it's different than what we are doing in Trauma 1. There we go. Okay. Any questions on PICLIS other than the kind of the follow-up items that we have? Kingman, okay. So Kingman, you don't have yours turned on either, you said. So I'll send you that list to make sure you can go through that all and make sure all fields that are for the full data set are turned on. Awesome. Okay. All right. Let's go back to this. All right. And again, reminder to publish because that is important. Okay, so I had some good questions about insurance. and I looked into this more, and after I had already answered it, and I think I have an answer. So if the patient has access IHS for insurance, do you want this reported as Medicaid or other government? So in the data dictionary, it says if they have IHS, recorded as other government. But this is a response from Mary that it said access is Medicaid, so it's a Medicaid plan for IHS. But I looked into it, and there are two different options. So there are people that can have just IHS funding that's not tied to access, and then there are people that have IHS through access, or it's tied. So if it says IHS access, that's the same as access essentially, so that'll be captured as Medicaid. But if it doesn't say IHS access, that's a different kind of federal funding that's separate from access, and it would be recorded as other government. Does that make sense? Okay. Yeah. I didn't know, because in the data dictionary it said record IHS as other government. And I was like, why would they have said that if it wasn't? And that they're two different things. So hopefully that makes sense. And then this question, if a patient has private insurance, do we automatically enter self-pay as secondary? I would put, and you would put NA unless it's otherwise documented. So for reporting purposes, we look at self-pay as they don't have insurance. So to have a first payer as insurance and then self-pay is you don't need to put that. So just put NA. So if a patient has a Medicaid plan, are they ever second or self-pay as secondary? Same thing, put NA unless they're purely self-pay, no insurance. That's when you would use that. Can you define the primary medical event field on the arrival? Let's see. Okay. Primary medical event. I'm not familiar. Danelle, do you want to speak to that? I'm sure there's an NTDB definition for it.
Yeah, that's if you're submitting to NTDB. And then that would be in the data dictionary, but it's basically if they had a seizure and then fell because of the seizure. That's an example.
Oh, okay. So the seizure then caused the car accident kind of thing. Okay.
Yeah, or a fall. Yeah, if they had yeah.
That makes sense.
I don't have the data definition up, but you can look in the dictionary.
Yeah. So Sharon, I would look in the data dictionary for the definition. Okay, thank you. Alrighty. Let's see. And then there was a few miscellaneous things. So as was mentioned, Yuma Regional is now on Vita Health. So that pick list update was made in Trauma 1, but you will need to go in and update that on your pick list options. I'll do it for the level 4s that are reduced. And then also ADHS is recruiting 2 volunteers to help with a panel deciding the trauma award recipients. There's a link to the list of awards, and I'll send out this presentation. And you would need to be able to attend a meeting in March after the nominations close. And there's like a grading rubric. So I don't know if any of you saw it last year, heard about it, but they did kind of like a trauma program manager of the year and that kind of thing. So if any of you or trauma program managers are interested in volunteering, let me know. Shelly, is it okay if they let me know, or do you want me to have them reach out to you, or any other?
Yeah, we're trying to coordinate that. And then like David Harden will be handing out the known nominations after the close date. So
okay, great. So let me know if you want to be a part of that. The next thing is the state patient field. So right now in Trauma 1, we have that little state patient, yes or no. That's not in the new registry because you don't need it. So I'm going to share my screen and show you. So because you pick where the patient should be submitted to, you don't need to put yes or no, because if it's not a state patient, you wouldn't put down Arizona for the submission. So if you go down here under information for submission organizations. So if it's not a state patient, then you would just unclick and then it's not submitted to the state. So, and then, yeah, same thing if it's an MTDB, that kind of thing. So if you're looking for the state patient field, it is not there and we don't need it anymore. So any questions on that? Okay, and I don't want to end on a downer, but I don't have CE for this meeting. I apologize, mostly just because it's not, it's mostly about the transition. So I'll try to have more educational content in the next TRUG meeting so we can ask for CE from ATS. So wanted to let you guys know, and that is it. Any other? Carrie, good question. Has anyone had any success in building a report for open charts to share with your team? Okay. I am meeting with Jody on Friday, so I will have him go over that, and then I'll try to record it and share it with you guys so that you can have that. It's hard to practice running reports when there's not data to kind of play with to run reports. So I haven't gotten into that a ton yet. So I will try to get an answer for you and share it with you. Okay. All right. Any other questions? Okay, you can't share it. So did you have success in making the report in general and then you just couldn't share it, or was it also making the report? Okay, so you made the report, you just couldn't share it. Okay, so I'll note that and ask him that in particular. So, okay, sounds good. Thank you everyone. Thanks for your patience. We'll get it all figured out and be in a good place soon. So appreciate everyone and hope you have a good week.